Cases of measles have now been found in at least 16 states, with the epicenter of the outbreak, more than 200 cases in West Texas, now spilling over into neighboring Oklahoma and New Mexico. It's an early test for noted vaccine skeptic Robert F. Kennedy Jr., the Secretary of Health and Human Services, whose fringe theories about prevention, natural immunity, and treatments have raised serious questions among the medical community.
It used to be when you and I were kids, everybody got measles. And the measles gave you lifetime protection against measles infection. The vaccine doesn't do that. The vaccine is effective for some people for life, but many people, it wanes.
Joining me now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, your reaction to those remarks from the Health Secretary?
Well, it's just not true. And you know, unfortunately, I don't know where he's getting his information from, but Alicia, one dose of the MMR vaccine, it's usually a schedule. The first you get in the first year of life. The second dose, the MMR vaccine, measles, mumps, rubella, you get between, say, 4 and 6 years of age, usually before you start, say, kindergarten. And what we know is that one dose is 93% effective over the duration of time at preventing infection. 2 doses, almost about 97%. And it doesn't wane over time, except in specific edge cases. And so he's just wrong.
Let's talk a few more fact checks here. A number of claims that he made in his Fox Nation interview last week. He suggested that it was very difficult for measles to kill a healthy person and that malnutrition played a role in the Texas outbreak.
So, you know, let's talk about malnutrition first. In terms of what does he mean by that? I'm trying to channel what his advisors or what he's thinking, just because I think a lot of people do believe his trope here that somehow a healthy diet gives a robust immune system and it can prevent measles. Healthy diets are really important to lower your medical risk, lower your cardiovascular risk, and to prevent a infection from becoming a severe infection. Absolutely. Does it prevent infection by itself? No, absolutely not. And so, you know, what is he confusing here? Alicia, what he's confusing is this concept of vitamin A deficiency. It's the only nutritional deficiency that we've studied when it comes to measles infections. And what we know is that in places where people are vitamin A deficient, not the United States, where it's very rare, but in places like East Africa and Asia, where it's very common, if a child, say, comes down with measles in those parts of the world, we proactively give vitamin A repletion, 2 doses in those places. And we also do here in the United States, just as a precautionary measure, because we know that it may predispose deficiency, it might predispose to a severe bout of measles. It does not prevent infection. So he's just confusing the basic facts there on the one element of our nutrition that might actually be beneficial if we replete it in the setting of a measles infection. Again, there is no evidence that any form of diet prevents measles infection. That's what vaccination is for. As to your first tee-up question, is this non-serious to somebody who's unvaccinated? Again, the data here is this is not something normal Republican administrations would debate. Right. About 1 in 5 people, 20% of people, if they're unvaccinated, end up in the hospital, particularly those that are adolescent or younger. So the facts just speak for themselves.
You know, we had an infectious disease doctor on earlier in the week, and I asked him when we would know that this had hit a point of crisis, and he had a very poignant answer, which was, a child has died. Like, we may choose to define a crisis as a child needlessly dying in this country. The Atlantic was able to interview the father of America's first measles death in a decade. The father did not vaccinate his daughter, and he said to the reporter from the Atlantic, he considers getting measles a normal part of life. He'd also heard that getting measles might strengthen your immune system against other diseases. Perhaps most of all, he worried what the vaccine might do to his children. Your sense of where people are getting this information, why there is clearly such an education gap here on this question, and the danger it poses to have someone running America's largest health organization, agency, that is repeating some of these fallacies?
Well, let me just say from the beginning, It is easy to play fast and loose, and the only people that play fast and loose with health facts, Alicia, are those that are never at the bedside. And that's the trope, and that's the phenotype of the individual surrounding RFK Jr. That's RFK Jr. himself. He's not a doctor. He's not a clinician of any stripe. So when you're not actually faced with the consequences of putting information like this out there at the bedside, of course, this might predispose you to be immune from those consequences and say whatever you want. It's sad. You would think that there's ethics and morals here, but that's not happening. So that's number one. I think that's what's happening. The people he surrounded himself with, the other doctors in the community that he surrounded himself with that are nominees, have had a history, his FDA nominee, obviously Dr. Oz at CMS, of also doing really specious things when it comes to adhering to science or not adhering to science. And so he's selected for that group of people that have been willing to sacrifice basic medical ethics and principles to advance his agenda. In terms of where's the origin of all of this? It's, look at what he did, RFK Jr., prior to coming into this role. He founded an organization called the Child's Health Defense, which just a few weeks ago was doing programming in parts of Texas saying that the measles vaccine, quote unquote, was responsible for this outbreak, not just the high rate of families going unvaccinated. So he's directly still contributing to the reasons why people are not getting vaccinated.
Dr. Vin Gupta, we spent so much time together during a global pandemic. I thought that folks had come to understand infectious disease better than it turns out we do. Dr. Vin Gupta, as always, thank you. Up next, a high-stakes